2014 will herald the implementation of an elements of the Affordable Care Act. We've had talks on the Affordable Care Act at plenaries before, but it seems like 2014, with all the stuff that's been going on, is really hitting home for us. How well will the needs of children be served as these elements are rolled out? And what can pediatricians do at the state level to assure kids are getting access to services? Our speaker now will be Dr. Ann Edwards. She's the chair of pediatrics at Park Nicollet Health Services in Minneapolis and chairs the AAP's Committee on State Government Affairs. She's a practicing primary care pediatrician in an urban immigrant community and has served on numerous state and national advisory committee. She is the 2010 Blanton Bessinger Child Health Advocate Award winner, and she will talk today on the 3-year visit, checking up on the Affordable Care Act. Dr. Edwards.
Thanks.
You want some skin to skin?
Good morning. Thank you so much for this opportunity. We're going to try to get through a lot of information, but great information for all of us. Oops. I don't have any financial disclosures, but I do have a disclosure. I actually grew up in Minnesota, and I never got the opportunity to go to Florida growing up. In fact, many of my peers spent a lot of time standing in line to see Mickey or the princesses, but I spent most of my time standing in line at an amusement park looking for this individual to talk to me. Paul. For those of you who don't recognize him, this is Paul Bunyan, a bit of a folklore giant in the upper Midwest. And he really took many, many years of coaching and mentoring. But finally, I think he's found his voice in healthcare advocacy.
Uh-oh. Oh, no. Whoa! Whoa! Ow, 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 ow.
Uh-oh.
Minnesota, land of 10,000 reasons to get health insurance.
Babe, little help.
Welcome to MNsure, the new way to shop, compare, and choose from a variety of health insurance companies to find the coverage that's right for you.
Babe, get your blue ox over here.
MNsure, where you choose health coverage. Minnesota, land of 10,000 reasons to get health insurance, and one great place to find it. Welcome to MNsure.
Thanks, Paul. Job well done. Now, just as Paul many moons ago went through a 3-year checkup, we too are going to do a 3-year checkup on the Affordable Care Act. We're going to look at its development, recognize its strengths, and look for opportunities to support its optimal future. Now, most of my patients present with a few other problems. I don't know about yours. And certainly the Affordable Care Act presents to us today with a few little glitches. We all know the issues around the ACA marketplace rollout, at least the technical difficulties. But just as the President has stated, the ACA is not just a website, just like our patients are not just a problem. Recognizing these glitches, there will be a delay in individuals needing to sign up for the marketplaces, but again, this will move forward. So in order to better understand what's going on with our patient, that is the ACA, let's take a closer look at how we got here. What's the history? Where were we? In 2010, healthcare costs were escalating at an alarming rate. 17.9% of the gross domestic product was spent on healthcare costs in 2010, rising to an estimate of 20% in 2020. And for all of that, we were ranked by the World Health Organization as 37th best healthcare system in the world. 6.2 million children were uninsured in 2011. 1 in 5 uninsured adults were in 2012. And so there was a little bit of debate, as everyone might recall. But on March 23rd, 2010, the ACA was signed into law. Then there was more debate and Supreme Court hearings. And on June 28th, 2012, the Supreme Court stated this was the law of the land. And then on November 6, 2012, there was a series of elections. And with that, it was assured that with the re-election of the President and the Congress, that this would not be overturned. With that, we began to see numerous protections for children's health. Coverage to age 26 on parents' health insurance policies. No pre-existing condition coverage denials for children to age 19. Families now can choose a pediatrician as a child's primary care doctor. Coverage of bright futures without cost sharing in all plans. Caps on out-of-pocket costs for individuals and families. No lifetime dollar limits on insurance plans. Insurance companies can no longer drop people if they get sick. Premiums are subject to rate review and must abide by the medical loss ratio. That is, insurance companies must spend their dollars on clinical care and quality. So where are we with all of that? Let's take a little bit closer look and examine the ACA. Children finally have access to a variety of coverage, and even if they get sick, their parents can rest assured that these coverages continue. 14 million children are receiving Bright Futures services without cost sharing. 105 million children no longer have lifetime coverage limits. 3.1 million young adults are covered by their parents' policies. Rate review saved consumers $1.2 billion in 2012. And the medical loss ratio saved consumers $3.9 billion last year. The ACA does a lot of things for families, and we have to continue to remember them. In 2014, many ACA protections will kick in for adults. That is, the parents of the kids we care for, including no pre-existing exclusions, annual dollar limits on essential benefits phase out, waiting periods of greater than 90 days are eliminated, and premiums will no longer be adjusted based on gender, health status, or utilization. On October 1st, as you recall, the marketplace is open. And whether it be MNsure, New York State of Health, Covered California, everyone had an opportunity to finally sign up to gain access to affordable care. In my state, my marketplace had 100,000 hits an hour, and after that, 30 to 50,000 hits an hour for the first week. The federal marketplaces, despite all the glitches, received 4.7 million hits in the first day. It all says people are interested. There is a demand. So how does the country look? The yellow on this map really looks at the federal government and where they're running marketplaces. The green is where states are running their own marketplaces. And the blue are what we call partnership marketplaces. Now, admittedly, the federal government is running many more marketplaces than they anticipated, and this may explain some of the difficulties. In the federal marketplaces, families can choose between an average of 53 plans with an average cost of $328 per month prior to subsidies. If you are between 100% and 400%, you will receive an advanced tax credit. And if you are less than 250% of the federal poverty limit, you will have cost-sharing tax credit to pay for out-of-pocket costs in health care. But most importantly, this is a no wrong door, meaning that families can enter a marketplace and learn whether they're eligible for insurance on the marketplace, in Medicaid, or in CHIP. In addition, You have an opportunity, if you have a small pediatric business, to gain insurance through the marketplace, and we have resources to help. Importantly, in 2014, our children in foster care who are aging out and between the ages of 18 and 26 will become eligible for Medicaid. Please let us know how we can help get all these children ongoing health care. Now, the ACA also had a provision to include a Medicaid payment increase in years 2013 and 2014. And we admit this has been another area of hiccups. And certainly it has been much slower for all of us to see those payment increases, especially in managed care plans. However, this $11 billion investment by the federal government is the first time the federal government has made such an investment with the goal to increase access for our most at-risk families and children. Again, we will be advocating to continue this much beyond 2014, but we need everyone in this room to share your stories of success, and share your stories for opportunity. With the Supreme Court ruling in 2012, it was ruled that Medicaid expansion was optional. While children are not immediately affected by this, families will be. And we know the positive impact that having a family wholly insured can have on the whole family's health. Medicaid expansion will decrease the uninsured, reduce mortality, bring billions of dollars to the state, and decrease compensated care. However, 21 states have yet to see the benefit of this. 6 states are pursuing alternate models. Many thanks to all the AAP chapters in those states not yet expanding Medicaid. They are working tirelessly to move this forward for our families and the children. So this brings us to the assessment. How are things really going? Well, in all honesty, confusion abounds. Everywhere you look, there's a different answer. A September USA Today Pew poll stated that 53% of Americans opposed the ACA, yet only 1 in 4 had any understanding of the ACA, and 1 in 3 admitted they didn't really know anything about it. However, when the provisions actually come into play, we find that many polls show that they are greatly appreciated. One story that illustrates this is as an individual at a state fair went to sign up for his marketplace, he said, "Well, this certainly beats Obamacare." All this suggests we have a need for education. And in a recent Kaiser poll, guess who is the most trusted source for this education? You. More than any other source, doctors and nurses are trusted to speak about issues of the Affordable Care Act. However, in the last month, only 22% of individuals said that they had heard anything from a physician or nurse about the Affordable Care Act. Where had they heard information? Social networking and the media, 2 of the least trusted sources. So we have a lot of work to do in education. We are in the middle of one of the greatest sea changes in healthcare since Medicare and Medicaid, and we need to be part of this dialogue. In many ways, the race has really just begun. Just like a child's developmental stages, we measure progress month by month. An enormous amount of work has been done. Great credit to everyone at the Academy and the state chapters for continuing to move this forward to improve children's health. However, as stated previously, 2014 is one of the most important years of ACA implementation, and we need everyone involved. We need everyone involved to assure the optimal future for children's health and for those who care for them. So that brings us to anticipatory guidance. That is, what do we need to do together in this stage of development for the ACA? First of all, the marketplaces. No doubt you've heard a few questions from your patients and our families or people who stop you on the street. As pediatricians, you can help patients learn more about insurance options that they have on the marketplace and let them know that the cheapest plan may not necessarily be the best. You can help families ensure that they have access to pediatric specialists and subspecialists in the plans that they choose. As a pediatric small business owner, you can look at options at the marketplace for your employees. And remember, you have people here to help you, so use those resources. Talk to your families about the consumer protections already in place for children. Talk to those that will come into place for families in 2014. We need everyone healthy in a family, and the ACA is one way that we are working to accomplish this. Medicaid payment increase. While this has been slow, pediatricians are beginning to feel the impact of this. As one of our peers stated, the Medicaid payment increase reinforces my practice's commitment to care for children in the program. We need documentation of the impact of the payments so that we can show the federal government this is truly making a difference for the families for whom we care. Send us your stories. Send success stories. Send opportunities for improvement. We need them all. We plan to advocate for extension of this payment increase, but we can only do it with your help. Medicaid expansion. Well, if you live in a state that's expanding, remind the parents of your patients that they too can now have access to health care. If you live in a state that is not expanding, unfortunately, your state is at risk. States will be passing up on $18.4 billion and leaving 3.6 million people uninsured by not expanding Medicaid. Remind your state leaders that Medicaid has a positive impact not only on the patient, but their families. Remind them that Medicaid expansion is good for their state. So what's the plan? Well, the prescription is really clear. Get involved. Share your expertise, your passion and commitment to children. The ACA is really here to stay, but we need everyone working together to ensure that every facet of the law works for not only the children we care for, but we as pediatricians. If you see something, say something. If you see increased Medicaid payments increasing your ability to care for patients, say something. If you don't see those Medicaid payment increases, say something. If you see families finally able to gain access to affordable health care, say something. If you see an opportunity to improve enrollment hassle, say something. Don't just sit back, assuming someone else will take the ball and run. We need everyone on board. We need to spread the word about what the ACA is doing. We need everyone sharing stories so that the ACA achieves its optimal future. With the ACA, we are starting down a path where children may truly finally have uninterrupted care throughout their lifetime. We do not know how great, how truly incredible this all may be for our whole nation. But where I come from, we know that babies sometimes really do become giants. Thank you so much.